We are after the top of the hour here, so good morning to most, maybe good afternoon to some, but good morning to most. My name is Kevin. You may have seen me on our monthly lunch and learns that we run from IntraHealth virtually here at the last Thursday of every month, with the exception of tomorrow's lunch and learn session. But we're not here for that today. We're here to talk about AI. And I'm very excited, very excited to have a special guest with us here today. I'd like to introduce Josh. He's the man waving and smiling there. He's with our Well Health team. He works closely with our profile team, that's me, and our Nexus AI team that has a special treat for you here today. So Josh will be walking us through a webinar today, just a 30-minute session here today. Josh focuses on all AI products, so you might see him pop up more than once coming up in the future. He'll be able to speak about the new Nexus AI scribe tool and the Canada Health InfoA funding that you may qualify for. Welcome, Josh. Thanks a lot for joining.
Awesome. Thanks, Kevin. Appreciate it. Really excited today to talk to us about the webinar focusing on discovering the future of medical documentation. So I'll click through the slides and we'll cover our kind of to-do lists in a second. First and foremost, we have some webinar logistics to cover. All attendees are in listen-only mode. The webinar will be recorded, and we've also opened up a Q&A feature. So as we get going, feel free to use that to submit your questions. We'll spend some time at the end of the webinar to try and get around to all of those. If any questions are missed today, we'll definitely follow up and get some answers to you. Our agenda for today is, first off, we'll go through a brief product overview to discuss what Nexus AI is and how the tool works. We'll then move into a product demonstration with the help of Kevin, and we'll show you how the tool works in action. Then we'll close things off with our Q&A session, answer some of your questions you may have about the tool and how to get the most out of it and leverage it in your practice. I want to touch briefly on a subject that, unfortunately, I'm sure all too many of you are familiar with in physician burnout. In recent years, there's been a surge in discussions on the subject, with the occurrence of burnout steadily increasing. According to some recent statistics from the CMA, 53% of physicians reported experiencing burnout in 2021, which was a huge increase from just 4 years prior at 22%. And additionally, 60% of physicians stated that their mental health had worsened since the onset of the pandemic. So some of the factors that are contributing to this burnout include increased patient volumes, time spent on documentation after hours, and the ongoing administrative complexities of managing a practice. Not only does burnout impact clinicians' health and well-being, but it can also lead to heightened medical errors or diminished quality of care. And so the demand for efficient documentation methods has never been more important. Achieving a balance between delivering top-tier patient care and managing these ever-expanding administrative workloads calls for a solution in streamlined and effective tools. And so innovative approaches such as the AI scribe are emerging as promising solutions to help physicians save time on administrative tasks, streamline documentation, which might encompass anything from diagnostic notes to patient histories and encounter notes as well. So what is ambient scribe or an AI scribe? Well, it's a tool that's capable of listening to your patient encounters and automatically generating a clinical note for you. And so we'll see this in action in the demo, but to share some more context, the tool listens into the patient conversation or patient-clinician interaction. It processes the interaction and provides a structured clinical note for you. So what it's doing is sorting out the small talk, the weekend, the weather, the cottage, the kids, from what's medically relevant and important, and it organizes it into a structured note for you. So when you're finished, you can just simply review your structured note, SOAP note, and copy it into the patient's chart. So to better kind of share the scope or the ability and limitations when it comes to AI scribes, we're wanting to put this slide in here to kind of share that. So the scribe, as I mentioned, can transcribe the patient encounter in real time. It'll generate a structured note for you, and not only a SOAP note, but any custom template or referral letter or whatever it may be. And we'll get into that in a moment. It also integrates with the EMR for a seamless experience and seamless documentation. It can also learn and adapt to provider preferences over time. Where we draw the line or some limitations come in, or it's not going to fully replace clinical judgment or documentation review. It doesn't handle highly complex or fragmented encounters without oversight. And it doesn't operate without the occasional human correction either. So while the tool is designed to enable you and get you 99% of the way there when it comes to patient charting, it's not going to be taking anyone's job. So on the screen here, we're introducing Nexus AI. So this is our AI scribe that in this case is toggled on in the EMR. It lives in the top banner there out of the way until it's opened up on the screen to look like our screenshot here. So it sits on top of the EMR and doesn't impact your ability to use Profile while it's running. We touched on the tool's capability in general, but we have some points on the side here to address as well. I wanted to kind of lean in and touch about these because, of course, the tool's capability is great, but what does that translate to in terms of an impact for the clinician? And so these points here, we're going to dive deeper into them from pilot and study results, but in general, it's capable of saving an hour or two per day when it comes to your patient documentation. It improves the patient experience as well, and I'll dive into that in a little bit. And it also, the third major point here is reduce the burnout for clinicians and administrators. So this slide here covers our key features of the tool and what kind of separates Nexus AI. I wanted to cover these and go over them in a little bit of detail before we dive into the product demo to give you a better picture of where we're going with this and also where it's at right now. So first and foremost is the enhanced note quality. So the quality of the AI is really important. And in this case, it costs a little bit more money, but it's a really smart investment from our team because it's a better experience for the user and improves the ability for the AI to capture the notes accurately and avoid including information or hallucinations that shouldn't be in the notes. And why this is so important is because of the next steps and roadmap for the tool. Well, I mean, first and foremost, it's important to have an accurate note, but it's especially important for where we're headed with this. Some of the features that we're going to be releasing soon are not only will it summarize your clinical note for you, but if you mentioned a prescription or a lab order or referring off a patient, we'll draft the prescription in the EMR for you. We'll draft that lab order and pre-populate. We'll draft that referral letter as well, so you can simply send it off and save. So this is a huge time-saving initiative that we've started, and it's in testing phase right now and soon to be released, which we're really excited about. Another feature I'll kind of give a teaser on is that we are working on billing insights too. So what possible billing codes from your encounter are there and which one might be most profitable. That one's a little further down the line, but we are hearing the physician feedback and continuing to develop the tool, which is why it's so important to have a good base with an enhanced note quality and accuracy. We have templates, which are fully customizable. We understand that SOAP notes are important, but some of you may prefer a different style of note. And so we've removed all limitations here. We have 75 plus existing templates from our drop-down menu that you can create with a click of a button. And we can create any template you may be looking for as well. So you can simply submit us an example or tell us the headers you'd like to see or how you want your note organized. So when you finish up with your patient encounter, your custom template or note will be there waiting for you. Referral letters and patient handout documentation. After the SOAP note, many clinicians will like to generate a referral or consult letter, perhaps an e-form to complete, and you're able to do so with the click of a button. And so we've added a patient handout option as well. That's been a common request. So you could generate a take-home action list for your patients, which summarizes their next steps. Nice and easy communication, again, with the click of a button. We offer multilingual support as well. So we have 35 plus languages. You can have a conversation in up to 4 selected languages and have your notes come out in your desired language, English, French, whatever that may be. We'll show off what those languages look like when we get to the demo portion. We also have, of course, EMR integration. The tool already integrates in Profile and will soon be integrated in other EMRs. So if you're on Profile, we can simply, we have a workflow to simply toggle this on for you. We'll offer support in that following up the demo or the webinar today. But we also have it available as a web address, so you can access it outside of the EMR or from your mobile phone. And when you log into your account, it syncs across any location you've logged in. So you could, in theory, take a note on your mobile phone and transfer it over to the EMR with a simple copy and paste just by logging in. The last key feature or point to touch on here is safety and security. It's quite a hot topic. Just taking a step back and a reminder, Well Health is a publicly traded Canadian company. We own, Ocean, Doctor Care, multiple EMRs. We own over 200 clinics across Canada and some cybersecurity companies as well. So we don't take lightly that the tool is only valuable for you if it's safe to use for not only clinicians, but for patients as well. And so we'll touch on this in some detail following up the demo. So let's jump into a product demo here. I'm going to switch up my screen share and call on Kevin in just a moment. I'm going to show you what the tool looks like and walk through some main features as well. So bear with me one second. All righty. So hopefully this screen looks familiar to you. The Nexus AI icon that we can see is in the top corner here. So when we've opened up a new encounter, instead of typing any notes in our notes section, we'll be able to click on Nexus AI, which will pop up this window within the EMR. You can drag this or move this anywhere you'd like so that it stays out of the way. And like I mentioned, you can still use the EMR as you please. Mine's already logged in here, but when you do click that open, it'll prompt you to log in at the beginning of the day. And a nice security measure that we've included is you'll be able to stay logged in for the day just by clicking off Keep Me Logged In. It'll automatically log you out at the end of the day, so you don't have to worry about an additional logout when you're finished up. The tool here, just to walk through a couple of the features before Kevin and I get into our demonstration. We can see here we're in the Create a New Note tab, which is where you'll go to start an encounter with a patient. We have a Encounter History tab. So if you don't copy and paste your note immediately after, not to worry. We have an Encounter History tab, which you can sort through, search for a patient, or find a previous encounter to open up. We also have a Settings tab here, which is where I recommend starting out when you get your account set up. This is a good place to customize what your notes look like, select the languages you'll be speaking with your patients to tell the tool. You're basically giving the tool a heads up. Look out for these languages. I'm just going to scroll through what our languages look like here so everybody can take a quick look. You simply click off the ones that you'd like to have selected and give the tool a heads up that that's what we'll be speaking with our patients. You can also select the language of the note to be output in. So if you're outputting your notes in English or French or other languages, you absolutely can have that as a default. We have the custom note template submission box here. This is where you'd put an example note and submit it to our team to turn it around in 2 to 3 business days. You can also submit through our support lines and we'll be able to have them added to your account. The default note template can be selected here. In this case, we'll do a SOAP note. You can also choose some favorites so that when you're finished up and need to generate another encounter, another note template, you can simply click from the drop-down menu and have your favorites right there. So it's nice and easy to select. Anytime you do make a change to the settings tab, you'll click Save All Settings, and then you'll be good to go to use the tool. So from the Create a New Note tab here, we'd simply click this button in the bottom right corner, and then the tool will start listening and transcribing our conversation. Simple as that. So Kevin, I'll play physician here, and we'll have you play a patient with a couple of issues coming in. I'll go ahead and click this button here. It'll remind me to gather a verbal consent, or at least a patient consent, which can be done by a form or verbally. In this case, I'll say, hey, Kevin, thanks for coming in. I'm using my scribe in the background. It takes notes for me and saves me some time. Is that okay with you?
Yes, it is.
Yeah, sounds great. So I'll click that button. It starts recording our conversation. You get a little audio feedback so you know the tool's working alongside a running timestamp. We won't click the stop button until we're fully finished, but I'll just draw attention to a couple other features before we dive in here. The scratch pad is a nice tool where you can copy and paste a medication list, a previous history, or type any notes down that you might not want to vocalize in front of the patient. The tool at the end will take into account anything medically relevant from the scratch pad alongside your verbal conversation with the patient to create your template. I'm also going to label this one here so that I can quickly go ahead and search it in the uh, encounter history tab afterwards. So you can do patient initials, a name, whatever you'd like. It's nice and easy to find afterwards. So Kevin, thanks for your patience and thanks for coming in. What brings you in today?
Hi, Dr. Sagan. So, yeah, the reason I'm here is because I've been doing a lot of running outside recently with the warm weather, and my knee has started bothering me. The last 3 to 4 days, I've been getting increasing pain in my knee. And this might not be related, but I also have a very sore throat, so it could be a cold. I'm not sure.
Yeah. Yeah, why don't we deal with both of those issues today? I'll ask you some questions here. Let's start with the knee. You mentioned it's been going on for about 3 or 4 days now. Was there any specific incident that you noticed the pain at, or has it just been kind of wearing over time?
It tends to get worse at the end of my long run days.
Mhm.
So the higher the distance or further the distance seems to bother my knee the most, and then the pain stays throughout every day.
Okay. Have you been taking any medication like Tylenol or ibuprofen to help with the pain?
I usually take 2 ibuprofens per day.
Okay. And how frequently are you running? Are you running daily now, or what's that look like?
Every day, sometimes twice a day.
Oh, good for you. That's pretty good. So with this pain, do you find it when you're walking as well, or is it's just from the running and the repeated kind of exercise and stress on it?
Oh, it is. It is when I'm walking, I'm going to the bathroom, anywhere. Even when I'm sitting, I feel pain.
Okay. Well, I'd like to kind of take a look and evaluate that just to get a better picture here. So I'll have you jump up on the bed here, and I'm just going to take your right knee here through a range of motion. So you let me know if we feel any pain as I'm moving it around. Looks good here. Looks good.
Yeah, I feel pain.
You do feel pain? Okay, so when we're in full flexion, it seems like you are feeling a bit of pain there. So I just want to do a couple of quick tests here to see if it's something that might be tissue related, or if it's just something that's more kind of external. So I'm just going to press around on the knee here. Do you feel any pain on the outside, on the exterior?
A little bit, yeah.
Yeah, a little bit of pain. Okay. And I'm just going to do a Lockman test here. Okay, that's negative. And I'm going to do a McMurray test as well. Okay, that's negative as well. So just based on my evaluation here, Kevin, what I'd like to do is refer you off to a physio clinic just to get a better look and understand exactly what's going on there. They'll be able to help you get back up to health and kind of better diagnose the issue that we're looking at here. And get you back up to speed on a program. So I'll make sure that I have a referral for you before we're finished up to send you off to physio. Now, Kevin, you also mentioned that you've got some type of sore throat that's going on. That's a bit of bad luck, the two issues in one. But tell me a bit about that. What's going on there?
Yeah, it seems to be at the top of my throat, but also it goes down deeper. And in the mornings, it's it's really deep, almost in my chest, like the pain.
Okay. And so does it hurt to swallow then?
It does, yeah. Swallow, even drinking water, it hurts.
Okay. And do you have any other symptoms? Any cough?
No, I haven't coughed.
No cough, no runny nose?
No.
No runny nose. Okay. You know what? Let's take a look at your throat here. So I'll get you to open your mouth and say "ah" there for me. I'm looking down your throat. I can see some redness and swelling. Looks like there's some exudate on your tonsils as well. I'm just gonna have a feel here for your lymph nodes. Okay, they do seem a bit swollen on both sides. Just gonna take a look in your ears here. Okay, they're all clear, so that's good. I'm also gonna get some vitals from you here, Kevin. So your blood pressure here is 120/80, so that's good. Your pulse is 72. That's good as well. And I'm just going to take your temperature here. Okay, it's 38.2 degrees. It's a little bit high. You've got a bit of a fever too. So, are you on any other medications? Do you have any allergies?
No, I just have an allergy to red dyes, but
Okay.
nothing.
All right. So what I'll do then here, it looks like a strep throat to me. So what I'll do is I'll start you on a prescription for penicillin to take 3 times daily for the next 10 days, 500 milligrams. You can come back and see me if things aren't getting better, but be sure to complete the course of your medication. If symptoms do get severely worse, please head to the ER to get a look at that. And you can also do saltwater gargles or drink warm fluids like tea to help with the sore throat in the meantime. But any other questions on the sore throat or the knee there, Kevin?
No, you've covered it great. Thank you.
Okay, awesome. So at this point, thanks, Kevin. At this point, we'll click on the stop button at the bottom of our note here, and our tool is going to work through that conversation we've just had. It'll take a moment or so, and it'll generate a clinical note for us so that we can simply copy and paste it. Now, in this small window, of course, you can edit in here, but you can also copy and paste it right to your notes section and do the editing over there. I'll draw attention. This is the desired copy button to hit, not the copy and mark reviewed, as that'll mark your note uneditable and like you're done with it kind of thing. So when we click this copy button here, we'll be able to move over and paste it into our note section. So we can right click and paste. We've also used this Insert AI Scribe button, so you could simply click on that to insert the note. So let's take a quick scroll through and see what our note turned out to look like. Here we have in the subjective section 2 issues. First is the knee pain, increasing pain in the right knee, lasts 3 to 4 days, running, persists through the day. And then we have our sore throat issue here as well. In our objective section, we've covered the right knee in the evaluation, or examination rather. The sore throat, some vitals. I noted the ears as well. Our assessment is listed just below. And our plan. So our knee pain, referring them off to physio, and the strep throat, the prescription for penicillin. We also have, as I scroll down, 2 nice little notes that are included in here, which can be toggled off if needed. But the first one is to address that the patient did provide consent for their note. And the second is a date and timestamp. So this might be helpful for billing purposes. Of course, we can edit these notes as we please before or after copying and pasting. But as we can see, the tool's done an excellent job of summarizing our note for us to make it nice and easy and allowed us to focus on Kevin for the whole encounter. So I'm just going to come back to my Nexus AI tool here because now I need to write off a referral letter. So from the encounter note, I'm going to go ahead and click on this generic referral template. And you can customize this as you need to. But this one here is going to recognize that I've seen Kevin for a knee pain referral and pick out the issue or all of the medically relevant details to the issue that we're referring him off for. And so we can see all the knee details are included in our referral letter. So we could simply copy it and paste that for now into our referral letter that we're sending off so that we can get Kevin in to see a physio. So it is a really smart tool in terms of its capability and understanding for referral letters, consult letters, and all the additional documentation that comes after the simple summarized clinical note. If we didn't copy and paste this right away or needed to refer back to it, it's here in our history tab, date and time stamped. There's our encounter with Kevin. I can pop it back open, generate any other note templates that I need to, and simply copy and paste. We do also have a view transcript feature here, so we can see the full verbatim conversation with all the small talk included. So we can always refer back to that just by simply toggling between the note and the transcript. The last feature to draw attention to is our patient handout. So on the odd chance Kevin's a little bit forgetful about his action items, I could go ahead and generate a patient handout for him, which is going to summarize his issues that we spoke about, nice and succinct, and the action items for Kevin so he remembers exactly what we spoke about and what he needs to do. We can copy and paste this to send it out in some communication or print it off so that Kevin remembers everything he needs to do from our visit today. And so that's our product demo showcasing the capability of Nexus AI where it's at today. To actually turn this on for Nexus, we'll have the admin or CM at your location follow a little step-by-step to simply toggle it on. It doesn't take very long at all. And we can also set up trial accounts so everybody can get a login and start to use the tool right away. I'm going to talk a little bit more and switch my screen share here about the impact this tool's had, the success, and then the funding program as well. So I will switch up my screen share here. Bear with me 1 second. And jump back into presentation. So what I wanted to draw attention to in more detail was the success that we've had with this pilot and, with this tool rather. And we've gone out and done some large scale pilots where we've conducted surveys and collected feedback from our doctors. And it's been a tremendous help in terms of improving the tool and finding what's actually most helpful, but also to share the experience of those who have taken the leap to incorporate AI in their clinics. We've been able to improve efficiency first and foremost. Physicians saving those 2 hours a day adds up to somewhere around 10 to 12 hours weekly when using Nexus AI. A big part of this is not only the time saving, but the alleviation of the cognitive load. So we alleviated 85% of cognitive load from capturing feedback. Physicians found this new time was helpful to take a lunch break for the first time in a while, get home early, not take notes home, or see some other patients and increase their volumes as well. The improved quality of patient interactions was a nice kind of surprise that we've noted from this tool's rollout. So from the patient's perspective, the use of the AI scribe during these consultations led to a significant increase in comfort, 92%, and satisfaction at 85%. And so nearly 80% of these interactions were perceived to strengthen the clinician-patient relationship as the tool reduces the amount of multitasking during these patient exams or encounters and allowed more face-to-face interaction between clinician and patient, not really worrying about jotting down notes or scribbling anything down and being distracted. We've also been able to improve the accuracy and documentation quality. So the AI scribe achieved 95% accuracy in transcribing complex medical terminology, and this translates to minimized risk and errors and omissions. So while the tool's consistent and creating properly formatted SOAP notes, it'll be up to you to choose what's your favorite kind of feature favorite outcome of using a tool in a practice like this. I wanted to include this slide as well. I know I've already touched on the privacy, safety, and security, but I wanted to include this slide to go over what that all really translates to. We do have PHIPAA and PIPEDA compliance. The data is hosted on Canadian servers. Our default is to store the data for 48 hours, but it can be deleted sooner at clinician or clinic's request. The tool is built by Canadian doctors and researchers, and of course, it's a Canadian company. And we've been approved by the Ontario MD pilots, the Canada Health InfoWay funding program, which I'll talk about on the next slide, and major health authorities across Canada as well. And so to talk about the Canada Health InfoWay AI Scribe program, Nexus AI is a pre-qualified vendor for the Canada Health InfoWay program. The program will fund up to 10,000 one-year AI scribe licenses for eligible primary care clinicians. They'll be able to officially open and apply in June. So we're a little bit of the ways through. So the floodgates are open. As there's a set number of these licenses available for the program, we do encourage you to express your interest to learn more and be notified as soon as we can submit you for funding or how the funding application goes. On our next slide here, we do have a QR code included, so you can pull out your mobile, scan that, and fill out a form to express your interest. And doing this, we'll be able to apply you immediately for the funding for Nexus AI subscription for 1 year. to fully cover the costs, no strings attached, no payment details down or anything like that. This will also automatically set you up on a free trial account, which runs for a month. So you'll have some time to test out the tool and get familiar. And while you're on that trial period, we'll get back to you to let you know how the funding application has gone. And if it was a success, of course, that trial will automatically be funded and you'll be able to carry on using your tool without any interruptions. I'm going to move over to the next slide, which also has the QR code so that we can move into our Q&A session here. So I do have some questions that have rolled in. I'll go ahead and open these up and start to work through them, but feel free to scan that QR code and express your interest so we can get trial access set up and apply you for that funding to get a free subscription for a year. So I have a question here. How does a scribe compare to other AI scribes, Tally, Heidi, in terms of accuracy, customization? Will each provider be able to customize? So that's a twofold question. To talk to the AI scribe market in general, this is a good point to bring up. We're not the only AI scribe. We are with Well Health, one of the largest kind of health tech companies that provides a scribe. So there is an advantage there with our large development and support and sales team. But a lot of the scribes have different pros and cons, and you're definitely welcome to test them all out. I think what does separate Nexus from the crowd is that pipeline or roadmap that we've spoken about. A lot of the smaller startup companies are at a very similar point with their capability. Some key things to look out for are the language capability and the accuracy that's involved with that. Customizable templates, if that's an advantage for you. Another big piece is the integration. And so we, of course, have, meet all of these criteria, which isn't an accident. But most importantly, I think what's going to separate us is the roadmap that's coming. So to automatically be able to draft your prescription if mentioned in your encounter, or draft your lab order or your referral letter, those are kind of the next big steps to separate us. But I think the biggest piece or the most positive feedback recently has been, at least at this point, is the integration and having it kind of within the EMR, nice and easy to use instead of a separate web app or something like that. The second part of that question is, will each provider be able to customize? So absolutely, with our customizable templates, each provider can submit their own requests. We can turn them around in 2 to 3 business days, so you can have your own custom templates built and designed for you. You can also, once it's been designed, share it with other team members or clinic-wide or organization-wide. So we're quite flexible and we can accommodate a lot of requests that come in on that front. Another question about the EMR integration. Is it pulling objective measurements, or does that need to be dictated? That's a great question. It is also on the roadmap. Things like auto-completing forms like age or disability forms with information not just from the scribe, but from the EMR in the pipeline. Being able to pull relevant details to that encounter. For example, with Kevin's knee, if we'd had an MRI and some other lab results or some other notes about his knee previously, we'd be able to pull that in. That should be an option that we have for our users. So there's more to come on that, and communication will come out on the direct pushing and pulling of information there. I've got a question here about the mobile app usage. So yeah, absolutely, we do accommodate the mobile app. So we can definitely use the tool from a mobile app. And that's simply with the web address that we provide. And it does absolutely link to the EMR integrated version, so you can access your history tab there. Just got a note here that we've run over time. So unfortunately, the rest of these questions we'll have to follow up with you directly. I do encourage you to get in touch by scanning this QR code. We'll also send some follow-up of a recording of today's webinar and some next action steps. If you do need to get this set up as soon as possible, feel free to reach out. But we'll get some communication sent out shortly. So thank you for joining us today. Sorry we ran a little late on time, and we'll get some follow-ups in touch soon.
Thank you, everyone. Thank you, Josh.